Okay, so you've had your facelift with us. You've probably got your bandage on. You're looking nice and snatched. So we're just going to go over some of those post-op instructions for you. So to go home with, we would have given you a little care package. In there, you're going to find ice packs, some gauze, an Aquaphor ointment, and a scar gel. Further on in the video, we'll go over how to use these products. So in regards to swelling, your swelling is going to peak in that first 24 to 48 hours after surgery. With that being said, your swelling is going to fluctuate for the first little while. So not to say that after 36 hours, it's going to start to go down and stay down. You will notice that the swelling can kind of stick around for, 1, 2, 3 weeks, just depending on how your body heals after the procedure. To help with the swelling, so with those ice packs, just making sure you're wrapping them in a cloth, paper towel, anything to keep a barrier between the ice pack and your skin. You can ice for 15 minutes on and then take a 30-minute break. And where you're going to want to ice is kind of behind the ears, the neck, and the cheek area. And then to help with swelling, just sleeping propped up. So with a few pillows, kind of making sure you're at a 30 to 45 degree angle. Doing that for the first week or so, just to help prevent the swelling from worsening. So in regards to a shower, so you're going to have your day 1 post-op follow-up with us here. At that follow-up is when we're going to take the bandage off. So just don't shower before that bandage comes off. Come in for your follow-up. We'll take the bandage off. And then that way when you go home, you can have a shower without the bandage on and don't have to worry about getting that wet or anything. With the shower though, just making sure that it's lukewarm, nothing too hot or with steam, because that's just going to increase your swelling. And just being very gentle around your incision line. So if you are washing your hair, making sure that you're not scrubbing or rubbing aggressively around the incision lines, and trying to keep the water away from the incision lines as much as possible. They're obviously okay to get wet, but we just don't want them running under the water the whole time that you're in the shower. And then just making sure to avoid anything like saunas, swimmings, bathing for at least 4 weeks. We don't want the incision lines to be soaking until they're fully healed and closed. To clean your incision lines, so for the first 48 hours, you're just going to kind of leave them alone. After the 48 hours is when you can start cleaning with a mild soap and warm water. And then you're just going to be gently applying the Aquaphor ointment to your incision lines twice a day, just making sure to keep them nice and moist. You can use your finger as long as you wash your hands beforehand, or you can also use a Q-tip to apply along the incision lines. For your post-op medication, so just refer to the video that we have in regards to your facelift medications. We go over all of them there for you. And if you have any questions after watching that video, you can always reach out to us at the clinic as well. For your follow-up appointments, like I said, you're gonna have that 1-day follow-up where we take the dressing off. We'll take a look at everything, make sure everything is healing nicely. After that, you're going to have a 7-day follow-up. So at the 7-day post-op follow-up is when we're going to start to remove some of the sutures. Again, take a look at things, see how everything is healing. And then again, you're going to have a 9 to 10-day follow-up. During this follow-up is when we'll remove the remaining sutures that are left over. Just keep in mind, some of the sutures that are placed are dissolvable, so not all the sutures that you have will be removed. Just the non-dissolvable ones after 10 days will all be removed from those areas. In regards to follow-ups after that, so you'll have a 1-month follow-up, and then from there we'll schedule more follow-ups going forward. So in regards to exercise, you can do a slow-paced walk for those first couple of weeks after your procedure, just making sure you're not doing anything that's going to raise your blood pressure, making sure you're not lifting any heavy objects or bending over for the first couple of weeks. And then after 3 weeks, you can resume no impact cardio as long as you feel like your body's tolerating it well. If it is, then after that 3-week point, you can kind of work your way up to your regular exercise routine as long as you're feeling well, not having any issues. If you do have any questions with that, you can always reach out to us. For heavy lifting, we ask that you don't do any heavy lifting or straining of the neck or incision line areas for 6 weeks. We don't want to be stretching any feelings of tightness. Just let that resolve on its own spontaneously. After your procedure, just make sure that you're using sunscreen daily. We want to make sure we're protecting those incision lines and your skin as much as possible. So using a mineral-based sunscreen as well as physical barriers like a wide-brimmed hat. And then we just ask that you let us know if you're having any of the following side effects. So a fever, any pus or foul smelling drainage from your incision lines, and increased pain or swelling that's either on one side or both sides, as well as if you're noticing an increased redness, tenderness, swelling to the area. For non-emergencies, you can contact our front desk during our regular hours. And for after hours, just contact the provider that had reached out to you prior to your appointment. They would have given you a number that you can reach them in the evenings and on the weekends. And if you're having an emergency not related to your procedure, just call 911, go to the emergency. And with that being said, if that does happen, please just make sure you notify our clinic so that we're aware of this as well. But otherwise, happy healing.